It is 10:08 at WPSL 1590, the talk of the Treasure Coast. And this happens to be the spot where you can extract medical information out of the Wierzbickis this morning. Good morning.
Hey, good morning, Greg, and good morning, everyone. I'm your host, Dr. Joe Wierzbicki from Florida Orthopedic Specialists, and we have a very special episode of Bone Talk today. We're joined by a very special guest, my wife, Dr. Bethany Wierzbicki. Good morning.
Hey, good morning. So happy to be here. Thanks for having me.
Absolutely. And so, like you may have heard before on our other shows, Dr. Bethany Wierzbicki is a general and cosmetic dentist here in Stuart, Florida. Her office is just west of downtown Stuart on Ocean Drive. And of course, you can find me in Florida Orthopedic Specialists in Port St. Lucie and in Stuart. And if you're looking for either Dr. Bethany or myself, we actually have a shared common website. It's easy to find, drw.org. Doctor all spelled out, w.org. And like I said, today we're going to have a special show. We're going to be talking about dentistry primarily, maybe a little bit of general medicine, maybe a little bit of orthopedics. But we're going to take advantage of having this super specialist on the show with us. You ready?
Thank you.
Yeah, that is so cool. And of course, Dr. Joe, we've discussed this a few times, and turning the clock back to about 2002, it was my dentist who mentioned to me that I might have a heart issue and go see a cardiologist. And he was right. And they put a stent in about a week later, and it's been there ever since. So the body is amazing, and it's all tied together.
Absolutely. And that was on our list too of things to talk about. And we've mentioned it on other shows. People who are not medical doctors, but you may be seeing for, podiatrist with your foot, or you may be seeing an eye doctor just looking at your eyes, or a dentist looking in your mouth, that they may be the first to, unfortunately, diagnose you with something bigger, like an autoimmune disease, a heart problem, diabetes. Dr. Bethany, what do you think about that? Does that happen very often? And what kind of stuff do you pick up on and push people to their general medicine doctor to investigate?
Yeah, there are a few things that I notice the most, and the most is inflamed gum tissues that I see all the time. We call that periodontal disease. And so one of the most common things that I see is the systemic disease of diabetes go almost hand in hand with inflamed gum tissue. So I always say, if it's undiagnosed yet, to go see your primary care physician. But something I get a lot of pushback from actually is I take blood pressure at every dental appointment where I'm going to be giving an injection. And I don't know why people don't like getting their blood pressure at the dental office, but I'm so happy to hear that story from you earlier about your dentist telling you about your heart, because basically we take blood pressure. I tell you, if it's really high, that's considered a hypertensive crisis, and you need to see your primary care physician. I cannot provide treatment today. And so,
sorry. We talk about it a lot. Bethany comes home and tells me about all these people's blood pressures that are through the roof and can't get treatment. And I was curious, and maybe we've talked about this at home before, but why is it that you don't want to perform like a procedure, an injection, an extraction in someone's mouth if they have an ongoing elevated blood pressure issue, like currently that day? Their blood pressure is 180 over 100. Is there, why don't you want to do that procedure?
Well, anytime that I work on a tooth, I always prefer to get that area numb. So when I get someone numb, I use an anesthetic that includes epinephrine in it. And epinephrine is known to increase your blood pressure. And if your blood pressure is already incredibly increased, the last thing that I want to do is increase it even more and create some type of emergency in my dental chair. And nobody wants that in general. So what I do is, if it's incredibly high, refer them to their primary care physician, make sure it's under control before we proceed with any dental treatment.
Okay. Bethany, I've got a question. How many of your patients don't have primary care physicians?
I would say quite a lot. Yeah, a lot of I see a lot of patients that come to the dentist and they want to get their teeth cleaned, but they don't see their primary care physician. So most of the time, I'm kind of their first line of defense of, oh, I didn't even know I had high blood pressure. I don't really even check it that often. And so the patients that do have it well controlled, I don't have to worry about, but I would say quite a few.
I would guess in my office, and you would see more people because you probably see you see a lot of healthy people in dental offices, unlike in my office, right? That people aren't coming in for more preventative type services. I'd guess it's more than 50% of my patients don't have a primary care doctor and don't see them regularly. And I'm guessing it's going to have to be even higher with your practice, Bethany.
Yeah, because I see them on a regular basis. So I'm always trying to, promote them to see a primary care physician as much as possible.
So, Dr. Bethany, let's talk a little bit about what should someone be doing for preventative care. And from my understanding in dentistry, it's kind of similar to the rest of medicine, is that an ounce of prevention is worth a pound of cure, and not enough people are doing that prevention. So maybe a way to look at oral hygiene. So if you include things like flossing, water picking, brushing your teeth, scraping your tongue, doing the swishes every day, going to dental hygienist cleanings, what would you say is the bare minimum that someone should be doing? And then maybe what's the 99th percentile of humans out there doing? And then what is just too much? And I'm sure you see all of it. And for the most part, I'm guessing you see less, and we're just trying to shoot for bare minimum. So how would you break that down?
I would say bare minimum, and this is what I tell my pediatric patients as well. Those little guys, I say, please brush your teeth for 2 minutes twice a day. And then I just put the twos right next to them. So hopefully 6 in their head. And if you can brush your teeth once in the morning, once at night for 2 minutes, I mean, that is probably the best place to start. I like the rest of your question when it comes to the people who are doing too much, but that's more rare that somebody is doing too much and causing damage to their teeth. But most of the time, if someone's brushing far too much than they should be, it's because they're wearing away their teeth. And I just never see that, to be honest.
So if you had someone with, just chronic anxiety and they just have a thing about having just clean teeth constantly, would they run into a problem of wearing out like a surface of the tooth, or is it going to be receding gums? What's going to be the problem that they would develop by being over aggressive?
Yeah, I would say receding gums would be the most common thing you would see, is because they're pushing too hard because they're obsessively brushing. So typically that comes with more pressure. And so receding gum lines may be more sensitivity because the root surface of your tooth would be more exposed, and the root surface isn't as well protected as the top portion of your tooth. That's covered with enamel. A lot of people are aware of what enamel is. So if you don't have enamel, that's going to be a lot more sensitive.
Okay. All right.
Dr. Joe, I know you guys, when you have your 193 page questionnaire that you have to fill out.
Medicare requires it. It's not me. I'm not.
No, I get it. But, I was a little surprised in that the dentist will ask what medicines you're taking as well. And again, as Bethany was saying, you're really the first line of defense, if you will.
Yeah, definitely. Hey, Dr. Bethany. So going back to this question of oral hygiene, and I like it. You got the bar set pretty low for the general public here. 2 minutes twice a day. So that's the bare minimum, which we know a lot of people aren't doing. What's a very good patient doing as far as oral hygiene, in the same kind of list that I picked out before, flossing, water picking, brushing, scraping, swishing, going to this many screenings, this many times a year? What's a very good patient doing?
So they're doing at least the 2 minutes twice a day, of course, but then sometimes they're throwing in that third brushing midday.
Okay.
And if you're going to get that third brushing in, I'm just going to put in a plug here. Kind of wait about a half hour after you're done eating or drinking, because after you eat or drink, you're getting an acidic attack on your teeth. And then if you brush right after you eat, you're kind of creating a little bit more damage. So if you're going to add in that third brushing throughout the day, just give it a little time for all the acid in your mouth to settle down, and then do that third brush throughout the day. Flossing is going to be the next best thing.
Flossing
And so
once a day, twice a day for very good status?
I would say very good would be once a day. Yeah,
Okay.
once a day. And I would reserve that for the end of the day, because when you sleep, you're either sleeping with your mouth open or closed, and you have so much bacteria. The bacteria in our mouth is incredibly dynamic. I mean, we don't even really fully understand all the bacteria that's in our mouth. I think we've only understand about 30% of what's going on. I know. And so doing your flossing, reserving that for nighttime would be the best, I think.
Okay.
And I floss about twice a year or so.
Oh yeah, at least you're honest. I appreciate that.
But he's meeting the bare minimum. It counts.
Yeah, that would be real minimum. All right.
So Dr. Bethany, I know one of the very common questions you get from people is, I want whiter teeth. How do I get whiter teeth? And I know your first answer is, doing the basics, which most people aren't doing. So how do you get whiter teeth? What do you tell most people?
Oh my gosh, that is the most common question. So I'm glad you're bringing this up, because the first thing I always say is, well, it depends. Let's take a look in your mouth. Let's see what's going on. Do you have tons of existing fillings in your mouth? Do you have existing crowns that have porcelain on them? Because those items we cannot whiten chemically. The only thing that we can chemically really whiten is your natural tooth structure. So the first thing is how much of your natural tooth structure is showing. And so once we decide that, we can either replace those existing fillings that you have to a whiter status, because they do stain over time. All dentistry has a lifespan. I'm just as much as I'm sure like your hips and knee replacements, I'm sure they have to be replaced after a certain
general ballpark lifespan. Yep.
Yeah, so dentistry is the same way. And just like you're walking on your feet and your legs every single day, wearing away at those joints, we are chewing and eating and talking and biting so often throughout every single day. So we have to be concerned about lifespan. So they wear out just like almost everything else. So if it's been 10 plus years, those fillings are definitely going to stain. Porcelain doesn't stain as much. So if you have veneers or crowns, those are probably still nice and white for you. It's your natural tooth structure that we want to whiten. So the answer to this question is it depends. What I like to do is start by using tooth whitener. I use something called Opalescence Go. I use it.
What's it called again? Opalescence
Go. Yeah, I like it because it's not even a custom tray. I just give them to patients, and you put them in your mouth. You wear them for 20 or 30 minutes per day until you get your desired results, instead of buying those custom trays, which I mean, those work very well, custom trays with those syringes that can just add up to a big financial responsibility. So I love these Opalescence Go ones. I get great results from them. They're easy to use. And so we always start there and then see if the fillings are standing out. If there's more involved, then we can replace those fillings, replace those veneers, replace those crowns if your desired result isn't reached.
Okay. And you said sometimes people want whiter teeth, but there may be some underlying pathology or problem with that tooth. And so is it right? And sometimes you have to address that issue if you want to get the tooth whiter. I mean, maybe you need a root canal, or maybe that tooth is broken and needs to be removed. Or do you see problems like that need to be addressed?
Oh, you're brilliant. I can't believe I didn't bring this up myself. So people can have dental decay, which typically is very dark or black, especially along the gum line. So sometimes people just want to get their teeth whiter and they don't want to invest in the disease that's actually in their mouth. So what they care about is just the whiter teeth and not getting the disease that's actually in their mouth addressed. So I would recommend removing all of the decay that's already there first. And just by doing that can help a lot. Mechanical debridement of debris in your mouth is huge as well. So if you don't have that much decay that's like black or being displayed in your smile line, what typically staining is coming from is just you're not really getting a good brushing in. So most of the time, if you're getting that 2 minutes twice a day or using an electric toothbrush, which honestly changed my life. I don't want to sound over dramatic here, but changing from a manual toothbrush to the electric one that actually vibrates the tooth you get so much debris off of your teeth that your teeth whiten, honestly, within weeks or even months of you using it. So mechanical debridement of the teeth, of course, and then removing any disease that you have in your mouth, getting rid of those cavities, and then, of course, everything else that we just talked about.
Okay, doctors, we've got John on the line. John, you're on with Doctors Wierzbicki.
Well, thank you. Hello, doctor.
Good morning.
Hi.
Can you hear me all right?
We
Yes.
got you. Go.
Okay. Well, she answered. She was answering my question that I had was about to ask. But I don't have a whole lot of teeth left. But my teeth are, natural teeth, and I use either peroxide or a little baking soda occasionally. Is that okay for for other people to use as well? I mean, for people to use on a fairly regular basis.
Yeah, absolutely. I think that that's fine. It does have, it's really abrasive. So that baking soda is abrasive. So that mechanical debridement that I was talking about, that baking soda is really good, like kind of hard and granulous. And so that actually helps with the mechanical debridement, just as long as you're not using it over excessively, of course, and causing damage. But I have people use it and they love it and it works just fine.
Is the
ones that I
peroxide a
don't-
problem, or do you need to be careful with the amount of that, or can the mouth handle quite a bit?
Yeah, the mouth can handle it. Most of the time,
It
I
can.
tell people dilute it a little bit.
What would you
'Cause-
dilute it with? Just water,
Water.
baking soda, peroxide?
Yeah, because most people can't handle just like the pure hydrogen peroxide, because I can't even handle that. It's
Yeah.
pretty strong. So if I really wanted to use it, or if I have a sore throat or something, I just want to get everything super clean in my mouth, I'll rinse with that, but I have to dilute it. So some people are pretty intense and they can do it themselves. So that's more power to them, but maybe not using it over extensively for a long period of time.
So if you were going to do it, what kind of ratio? Like 1 part water to 1 part baking soda to 1 part peroxide, or have you really? Is there a ballpark formula that you would that people could consider?
No, I don't have a formula. If it were me doing it, I would take.
I'm
my
sure Dr.
toothbrush-
Google knows.
Yeah, I would dip it in the water, dip it in the baking soda.
Oh,
and
okay,
just
a little
go-
splash of
yeah,
each.
I wouldn't.
Yeah.
Yeah, I don't have my own formula. No, personally.
All right. John, did they answer your question?
Oh yeah, I just wanted to tell them that my dentist had a sign on the wall that said only floss the teeth you want to keep.
I love that.
great.
That is great. Yeah.
Now, let me tell you. If you have a minute, I want to tell you a humorous story.
Sure.
Okay.
When I was 18 years old, I had to have a back tooth extracted. So I asked a few people, and they had used an oral surgeon that used sodium pentothal. And they told me how natural it was. You won't feel a thing. You go off. You don't know you're asleep, and you wake up, and it's over. Well, anyway, I'm in the chair. He hooked me up, and I'm getting real drowsy. I could barely stay awake. And when he walked towards me, I said, "Doc," I said, I'm still awake. I can feel, my teeth, my mouth." I said, "Shouldn't I be asleep by now?" And he said, "I don't think so. I haven't given you anything yet."
Oh.
Oh,
All right. All right. Thanks, John.
That's great. Yeah, thank you for the call. And if anyone wants to give us a call live on air this morning, the number for Bone Talk is 340-1590, 340-1590. And if you want to find Dr. Bethany or myself, Dr. Joe, we're at the same website, which is drw.org, doctorw.org.
You know,
All right,
I've
so-
been on like a 3-time or maybe 4-time seeing a dentist ever since I was a kid. And I was really fortunate. I had braces for like 6 years. And a real good guy in Beverly Hills. And I was very fortunate to have had him as orthodontist. And, I think about that. And the only cavities I've ever had in my entire life have been what he called brace cavities.
Brace,
And
like bacteria getting under the brace and going into the tooth
I
that way?
presume where they latch on the back teeth, I guess. I don't know. but that's where I was really fortunate not to get
Bethany, what's a
anything
brace
other than-
cavity? How is
So
that
what
different than another
happens is that-
cavity?
Yeah, so when you're wearing those metal brackets on your teeth, they're incredibly difficult to clean. So anybody who has braces, I highly recommend, or even if they have bridges, get a water pick so that you can properly clean in between the braces. But you get like these this white chalky appearance to your teeth that displays as the beginning of a cavity. We call that decalcification. And they're typically, when you get the braces off, you see these little squares of white right where the brackets used to be. So that's why anybody who has braces, I personally recommend them getting professional cleanings every 3 months, just because it's already difficult for us to brush our teeth, let alone when you put a whole bunch of metal in there, it's even more difficult. So that's what he's talking about, brace
Interesting.
cavities.
Yeah.
It's decalcification that wraps around the bracket because of difficulty cleaning.
Interesting. Paul's on the line for you. Paul, you're on with Doctors Wierzbicki.
Good morning.
Good morning.
Morning.
Hi, this might be a good opportunity for a new show.
Okay, okay. I'll take it.
Sign us up, Greg. Yeah. What do you got for
Yeah,
us?
boy,
Everybody
you,
gets questions on their health, so they get to that sales department.
yeah, yeah. This has really been enlightening. What's your question, Paul?
I had a tooth prepared for a crown. I'm gonna guess and say probably a good 1.5 to 2 years ago. And never had the crown put in place.
So you were wearing a temporary for that whole time?
As far as it's in good shape, it doesn't bother me, it doesn't pain me. The thing is still there, the piece where they would put the crown on. What is my option at this point?
I just want to clarify your question. You had a tooth prepared over a year ago and you were wearing a temporary crown for about a year now?
Well, I was wearing it till it fell out. So there.
Okay, so
on
that office still has your
It's been
final
open
crown?
now for probably a year.
Oh,
With no pain.
So
I
there-
keep it real clean, and
Hey, Paul, Bethany just asked if your dentist has the final crown.
I have the final crown. The only problem was it was done up in New Jersey. My stepdaughter's a dental hygienist, and when we went up there to visit, we'd actually get a free cleaning for whoever goes up. And there was a question with that tooth, so they prepped it for the crown. But I would have had to go on back up to have it put in place, and we never made that second trip. I do have the crown.
Well, Dr. Bethany can help you.
yeah, there you go.
Just pop it right on, right?
So sometimes in rare cases, that provider can send us a different provider, the crown, just ship it or mail it. Most of the time, if it's been more than a year,
I have it in my possession.
He's got it. He's got it on him.
Oh, he's got it.
He's already got it.
okay. Okay, so if you have it, the thing that we have to do is try it on and make sure it still fits, because that tooth has been without either a temporary for so long, our teeth shift
Right.
so often. So the crown may not even fit anymore, which would mean you would have to
Right,
get
right.
a new crown made. Worst case scenario.
But it could work. It could
It
work.
could work. It could very well could. I have had, luck in the past.
Wow.
Can they be relined or anything, like if it's necessary?
And
That's
you need
a
to
good
modify it a little
question.
bit.
They cannot be relined. The only thing that we can do is if the contact is too tight, I can adjust or remove some of the crown in order for it to seat properly. But if the crown isn't seating properly and you have wide open contacts, that's when we would have to make a new crown.
Right. Would it be possible to contact your office in relation to this?
Absolutely. Yeah, absolutely. Asthetic Dentistry of Stuart. Come visit.
What's your phone number down there,
okay.
Bethany?
I got her phone
Okay.
number right here. 772-888-5800. 1590 is her office number for Asthetic Dentistry of Stuart. 772-888-1590.
Perfect.
Just like the station.
Yeah, I was going to say the last four digits.
They stole your
sound
number,
familiar.
Greg.
Yeah. Ah, wait a minute.
She'll
Oh.
sell it to you. Yeah.
Yeah. Well, Paul, you also gave us some valuable information. I didn't know that there were any dentists in Jersey. I'm
Okay, thank you very much. I will contact her and see what maybe we can do with this.
Sounds
Great.
good. Looking forward to it.
all
Great.
right.
Thank you for our call. And again, if anyone wants to give us a call live on Bone Talk this morning, 340-1590 is the number for Bone Talk. And if you want to find Dr. Bethany or myself, Dr. Joe, both of us, Dr. Wierzbicki's, you can find us at drw.org. drctorw.org.
There
Yeah,
you
go
go.
ahead, Greg.
I think Eric is with us on the line. Eric, you're on with the doctors.
Hey guys, good morning.
Good morning.
Morning.
Hey, I use a Sonicare type machine, and I use water.
Whoa. Go ahead.
Yeah, in my Sonic machine fluid that I use, it's a combination of water, hydrogen peroxide, and strictly a mouthwash. I do that morning, evening, and also if I have a chance after lunch, whenever, but I at least do it once or twice a day. And I was just in my dentist, who I go to 3 times a year and have things cleaned and inspected. And she says, I've never seen such quality of gum in a older man's mouth. Now, granted, I am early 60s, but I am real happy that I've got good, strong gums, and I'm thinking the hydrogen peroxide is helping in that matter. Is this correct?
I would agree with you because mouthwash can sometimes be a little detrimental if you use it too much because it has alcohol in it. It can dry out your mouth. But hydrogen peroxide is really good. We use it for a lot of people who have inflamed gum tissues or have periodontal disease. We tell them to use it on a daily basis because it really kills a lot of the bad bacteria that we want to get rid of. So I think you're doing all the right things. So well done. Give yourself a pat on the back.
And chances are, I mean, it could be due to that mixture that he's using right there. But if I had to guess, someone who's going to that kind of length to take care of their teeth, he's likely doing other very good things to take care of his teeth. And so it could be some of those other things. You know, maybe he's brushing extra, maybe he's flossing as much as he should, for why he's got such great gum and teeth health. Yeah, would be my guess.
That's a really good point, honey. Thanks for pointing that out. That's very, very smart.
All right. Eric, did they answer your question?
Yes, very good.
Whoa, you got a radio close by your phone. It's look, creating a little havoc here. Go ahead.
But anyways, I love your show, and all 3 of you guys are great Americans.
You, sir, you too.
All right.
Greg, I think we've got more callers on Bone Talk this morning than we have the past month of doing Bone Talk with just orthopedics.
Yeah, nothing personal. Here's Bone Talk with Bethany Wierzbicki.
I'm used to it though. People like Dr. Bethany more than they like me, and I'm okay with that. I'm not surprised by how this is going at all.
It's very common though. Like a very intelligent instructor once told me that we have 52 teeth if we include our baby teeth. And that's 52 problems a person has. So if you're having problems, most of the time you want to talk about them. And that's what we're here for.
Yep. Again, the number for Bone Talk this morning, 340-1590. If you want to call us live on air, 340-1590, or you can find us at drw.org. Wow, great stuff. What were we talking about before the callers? Oh, I think we were getting ready to talk about crowns, Dr. Bethany. Some common things that I hear about and that I still don't understand is someone will say, I got to go to the dentist. I think I need a new crown. And they'll say, no, the dentist recommended veneers instead. And then sometimes I'll hear some other terms that sound similar to those. So what's the difference between crowns, veneers, and other things that you may consider instead of those?
So surface answer would be veneers are cosmetic, mainly for looks and appearance. And crowns are because you have some underlying issue going on. Sometimes people can get a lot of crowns for aesthetics only as well, but that's more rare. Most of the time we recommend crowns. A crown is when we have to actually remove tooth structure around the entire tooth. So if you imagine a tooth, I have to remove tooth structure around the entire tooth, so like a circle around it, and then a little bit off of the top. What that does is I'm removing decay that's on the tooth. I'm removing fractures, and most of the time the fractures are located in between the teeth. And then I have to put, and some people call crowns caps, so those terms are used interchangeably. So caps, crowns, I like to use the term full coverage as well. So I'm covering the entire tooth with a really strong material. And I choose that material based on the patient and what they need. So there's lots of different materials, and that's a whole nother topic. But if you have the choice, and you're listening, if you have the choice and your dentist is giving you a crown, if it's towards the back of your mouth, I still recommend full coverage gold. Gold is an incredible material. It's very malleable. It doesn't wick bacteria as much, and they last forever. It's almost impossible for a gold crown to break.
What's the other types of crowns that are often used or recommended outside of gold?
Yeah, so the other two common ones is the tooth colored ones. Everybody wants tooth colored ones now, which I completely understand. I would want a tooth colored tooth in my mouth as well, because cosmetics is definitely something that's growing. So the other two kinds are zirconia, which is incredibly strong. It's so strong that it can actually wear away at your opposing teeth. So it really depends on if you clench and you grind those teeth a lot, maybe we're going to recommend a zirconia crown for you. Now, the crown that I really enjoy using is called Emax. Has a little bit more wear to it, but they can break if your bite isn't adjusted properly. So you have to go to the proper provider if you're going to use certain kinds of materials. So if you have a good understanding of how your bite is supposed to be, I love using Emax because it's tooth colored, so everybody's happy with the appearance of it. And it's not so strong where it's damaging adjacent teeth. And there are so many. I love both materials. I love all materials. There's a time and a place for all of them. But generally speaking, that's what I like to use.
And you said it the other night when you were filling me in on your day, you said people's crowns tend to wear out really quick if the dentist doesn't adjust their TMJ or consider their bite. And it makes sense. And a lot of dentists out there aren't doing that. They're just putting the crown on. If you don't adjust, the forces that are going through it and consider that, then that's going to wear out that much quicker and break and have problems. Versus you and Dr. Amy Crary are very into TMJ health. And then therefore you're going to get the longest lifespan out of the crown. Is that right?
It's very true. And it's a little unfortunate. And I'm going to put down my own profession for just a moment here. Going through dental school, they really don't teach us much about our bites, and they call that occlusion. So they don't teach us much about occlusion. So ever since I graduated, you take so much continued education, and you have to if you want to stay on top of just how much everything is changing in general. But I really had to take a lot of continued education in order to properly understand your bite, where it should be, and how it relates to your jaw joint. I cannot tell you how many people have issues with their TMJ joints, and it's just an ongoing problem. People can have migraines, headaches, vertigo. They can't lay down, because they're having so many symptoms. And a lot of the times it can be related to, of course, your medications, but to this joint that's just super compressed. So I'm getting into so many topics here that is just kind of steering me away from crowns. Yeah. But this small topic of crowns can kind of go into a huge issue of creating TMJ pain. So making a good bite is really important when it comes to placing new teeth in your mouth.
Well, so basic dentistry, say, would they then, because the bite, at least when I was going to an orthodontist, that was really, really important to the doctor from like day one. So are they the ones that would normally catch the bite?
Yeah. So I refer to orthodontists all the time, and Dr. Amy Crary actually does a lot of orthodontics here in the office as well, kind of a specialized one to make sure that the joint is decompressed. A lot of times people in the past had teeth removed, and like I said, dentistry has changed so much for the better now. So in the past, people have been taking out their teeth in order to create straight alignment, but it's not good for the joint itself. So that's kind of something that's in the past now. But we do refer to orthodontists where they really focus on the bites, because most of the time some people have their lower jaws are so far forward, their upper jaws are so far back, they have cross bites, and we have to get orthodontics involved if you want to properly fix the issue. Sometimes people are blessed and they already have good alignment, and then we can fix it with bite adjustments or new crowns. But most of the time you have to move those teeth around a little bit. And that's why Invisalign has gotten really popular in adults.
Hey, Dr. Bethany, am I remembering this right? And orthodontics, for the most part, they're focused on getting your teeth straight, not as primary to them is making sure that your TMJ is going to be straight and healthy. So that's kind of a newer thing that's coming up. Is that right?
It is a newer thing that's coming. Yeah, a little bit. It is.
Yeah, I don't want to overgeneralize, but.
No, yeah, it definitely is a newer thing that's coming up when it comes to the jaw joint. It has been ignored, I would say, in all of dentistry up until maybe about the last 10 years. It's becoming more and more prominent because so many people are having more issues. So I would say it's been vastly ignored, and it's just slowly kind of coming into the limelight. I mean, for example, dentistry has a specialty, a TMJ specialist now. It's just fully accredited only about a year ago. And there's only like 2 in the state of Florida. So is
Dr. Amy one of those? I mean, I'm guessing if she's not, she will be soon.
She will be soon. Yes, she will be soon. But you just have to go through the accreditation process. But she has her fellowship in the TMJ joint. And she just, if somebody gets a lockjaw, they don't even go to oral surgeons. They come to Dr. Amy.
So we were talking about crowns, and what you do different than most providers is that you're considering the TMJ joint in how you address the crown, how you pick the material. Are there other things that you do, and you do a lot of crowns? Are there other things that you do different to other dentists that maybe you think get you better results?
Yeah. So I like to preserve as much tooth structure as possible. They call it Biomimetic Dentistry. It's a word that I never say. Yeah.
What did you say?
Really
Biomimetic.
Biomimetic. Yeah. It basically just means we try to preserve as much tooth structure as possible. So if somebody has a fracture in their tooth and it's only on the first half of it, I'm only going to remove that half of the tooth and put what we call either an onlay or inlay in that tooth. It's kind of a fancier word of a crown. It's essentially a crown, but I'm not removing tooth structure that's unnecessary, which has been a thing in the past, because in the past we've only had certain kinds of cements that we could use, and we haven't had what we call a chemical bond. And now we have a chemical bond that we can put our crowns or bond the crowns to the tooth itself. And in the past, we've only had luting cements. So we have had to create retention in the past in certain ways by mechanically debriding and removing tooth structure. So now we don't have to do that. So I can preserve as much tooth structure as possible. So I would consider myself more of a conservative as possible dentist as possible.
So because of the improving technology with glue, with cement
glue,
for this stuff,
essentially. Yeah, thank you, glue.
you're able to preserve more natural teeth, and the more natural, the better. Yeah,
absolutely. Yep.
But it's very interesting, and it is now you for years, what, 15 years or so, with Florida orthopedic specialists, you have always stressed the continuing education being on top of orthopedics.
Mhm.
Your wife is that way in the dental area as
I'm sure she
well.
gets sick of me talking about studies all the time, but I come home and I'm talking about this study that I read, that study that I read. And Bethany tolerates it pretty well because she's very academic too. But yep,
Well,
we like studies. We like academics.
Yeah, well, it does sound though like dentistry, really in what, the last decade or so has really changed pretty dramatically, I would say, Bethany.
I would agree with you, and I try to promote that as much as possible. Well, to the experience itself alone, people are so afraid to come in, if they're even in their 50s or 60s, because of the experiences they had when they were younger. I mean, now we use anesthetics, like we get people numb before we do anything, and they have these terrible experiences. And I just try to advocate for come in, see how things have changed, and we can try and make it's more of like it's a completely different type of service that we're providing as well. So if we can create a good dental home for you, you're more likely to take care of your teeth and not need dental treatment. And so if you're not seeing a dentist for 20 plus years, you're more likely to need a lot of dental work, which nobody wants in general. So I completely understand, when people come in, they say, this is not my favorite place to be. I get it. We're working in a very personal space. And it's not like you can look away. We're working in your mouth. It's so loud. We're spraying water, but anything that we can do to make you feel more comfortable. And if you're not comfortable, we ask you to tell us to stop so that we can,
To give you medicine to make you comfortable, give you laughing gas.
Yeah, we can do that. We can give you medication to make you calm down. Or there's even some dentists that will sedate you. That's a little bit more rare, but that is an option.
Well, yeah, and beware of sodium pentothal because that is a truth serum. So, yeah, I'll never forget. My dentist learned a lot about me when I was under. Oh,
all right.
Hey, Dr. Bethany, I have another question. So I hear a lot about implants, and you're always telling me about all these different implants that you're doing. And I hear about teeth in a day. Is this the same thing, or what's teeth in a day and what's implants?
So just marketing in general out there, they'll put a commercial out there and say, get all new beautiful teeth all in one day. And so it's great because it is bringing people into the office and asking us questions, but it really isn't all in one day. It's quite a relationship that you have to create with not only your general dentist, but an oral surgeon most of the time too. Sometimes we have to get a prosthetic dentist involved. Prosthetics meaning like fake teeth, essentially, or crowns or removable teeth. It's a team effort. So there's a lot of work that goes into what we call teeth in a day. There's a lot of appointments leading up to it and after it. So in a way, we create a little bit of a marriage whenever we do cases like this, because we get to see each other a lot, and there could be a lot of exciting, but yet complications that can come along the way. So when it comes to teeth in a day, what it is the patient's teeth are not worth saving anymore. And I'm a huge advocate for saving their natural teeth whenever possible. But there are cases where we have to remove all of the patient's remaining teeth, place implants, and when it comes to teeth in a day, you have to place at least anywhere between 4 to 8 implants on the top and 4 to 6 on the bottom. It could be more depending on what the patient needs. But you place those implants on the top and the bottom, and you actually screw in a prosthesis teeth into those implants. So you do not remove them. It's like getting a whole new set of teeth. That's beautiful, that works well. And most of the time we give you a temporary piece to wear for a while to make sure that your bite is accurate. And then after we stabilize your bite, then we move to the final. And so it is a process, but technically speaking, the day you place implants, we do screw in some teeth. So it's like you're getting a brand new teeth in a day. So that's the marketing aspect of it. And so it really does appeal to a lot of people, but I just really want to inform everyone that it's not all in one day. There are multiple appointments leading up to it and after it to ensure that everything is stable.
Now, who does that? Is that a surgeon that would do that, or can you?
Yeah.
Who's even offering this? I've never heard of teeth in a day. Is this like a corporate marketing salesman thing
Oh,
that
I've
I just haven't
seen
heard of before?
The television spots are all over the place.
Is this like laser spine surgery? You know, it
Yeah.
sounds so magical, so good, too good to be true. And well,
Yeah,
you know about that.
You walk in the morning and walk out with new teeth. Supposedly, I don't understand that.
Yeah, a lot of the corporate offices are the ones who are creating the marketing, which I mean, in some ways works for us. But what we want to do is just do everything properly, which for me, it does take a lot of time and team effort. But to answer your original question is who does this? And I would say almost everyone offers it, but it's a matter of who you get involved. So I get an oral surgeon involved. And I get an incredible lab involved. So I have a lab that I work with who I honestly could not live without because they have the same understanding of occlusion and bite, and they have great results. And I'm the one who installs it essentially. So I do it based on a team effort.
Well, great, Dr. Bethany. Couple follow-up questions here as we're finishing it. We have to do this again because we have way too many questions here still.
This is great.
So,
awesome.
What is your favorite patient or procedure? What's your favorite patient? What kind of procedure do you like doing the most? Are you the best at?
I do think cosmetic cases are the most rewarding because
and that's like veneers and crown veneers.
Yeah, veneers,
or implants,
crowns. Yeah, and it could be implants. There's like a lot of that goes into cosmetics, but creating a new smile for someone is almost immediate. You know, if I put veneers on someone, when you cement them that day, or even put the temporaries on that day, I mean, they walk out just so happy and so excited, and you're almost creating a new lifestyle for them because they're so much more confident in themselves. And so that's one of, I would say, a really rewarding aspect of dentistry, and it's almost immediate too. Like that's why I would say it's one of my favorite things, because it's just one of those immediate gratification things, which I think everyone always wants in general. So I do like the cosmetic aspect.
What's the difference between dentures and veneers or some of that other stuff that you mentioned?
Yeah. So
how does that fit into the spectrum? Yeah.
This is a common issue, is how do you replace missing teeth? So and a lot of people have missing teeth. It's very common. So someone comes in and they're missing one tooth. I will recommend an implant, maybe a bridge, if that's an option. And we can talk about bridges here in a second if you want. But if you are missing multiple teeth on both sides of your mouth, we can offer you a removable denture, and it could be partial or it can be complete. So if you have some teeth remaining in your mouth that are worth saving, it's considered a partial denture. If you have no teeth remaining in your mouth, it's considered a complete denture. So those are great options for people who don't have teeth or who are missing multiple teeth. And sometimes people cannot adapt well to those, and that's where implants come into play. So if you have a complete denture and it's just flopping around in your mouth, we highly recommend placing a couple implants. If you place at least two, you can get what we call an overdenture, where we actually attach those two implants to the denture itself, and it kind of clicks in. So you click it in,
to
and you
give
click
it
it
increased stability. Is that what it's doing by having the implants?
Yes,
with the denture.
A lot more stability. So when you have all natural teeth, obviously you're chewing at full capacity. When you lose your teeth and you're using dentures, your chewing functioning is at 10% of what a natural dentition is. 10% is not very good at all, especially when we're eating every single day. And some people can adapt well to it. I mean, they have soft foods. They got those delicious pastas every day for the rest of their life, but if they don't like that and they're not adapting well, then we want some more stability. And each implant that you place creates more and more stability.
Oh, girl
Okay.
after my heart. Pasta every
Yeah.
day.
So, and you mentioned doing you remove some teeth too. Like someone's tooth gets infected and you'll yank it right out there in the office.
Yeah.
But that's kind of, you don't want to be doing as much removing of teeth if possible.
Yeah.
Yep.
If possible, I am
Like, and
always
just
an
ripping it out and doing nothing else. I mean,
and doing nothing else. No,
Yeah.
because there's a lot of issues that come with that. Because when you
so what's the
remove
problem
tooth-
with doing that? Yep.
yeah, when you remove a tooth, if you have some teeth in the back, they're going to shift forward. You're going to lose a lot of chewing functioning. But when it comes to if somebody has an infection and the tooth is worth saving, I am always about getting a root canal, putting a crown on that, putting a filling, whatever it is that you may need, trying to save that tooth whenever possible, because we're always trying to delay the next level of dental treatment for as long as possible. So for example, I do say that root canal therapy is a holding place for a future implant. It's just kind of the way things go. But if I can get 10 or 15 years out of that tooth before placing an implant, that is much better for your bone level. It's much better for preserving space in your mouth. It's just much better in general. And so to save your teeth so that we can delay the next level of treatment. Because we are outliving the natural lifespan of our teeth by like 3 or 4 times. What is it? Like, I don't know, back in Neanderthal days, we're only living till we're 30 years old if you're lucky. And here we are living till we're 90 or 100.
Yep. We're outliving our body, outliving our joints, our
Yep.
teeth, all of it.
No kidding.
And we're,
Well,
and yeah.
Dr. Bethany,
Yeah.
we've got about 30 seconds left. What's your phone number?
Oh, yep.
Oh.
Yep. You have your
Yeah.
telephone number for your clinic, Dr. Bethany?
Yeah, 772-463-4026.
Yep. Or if you want to find both of us, drw.org. Yeah, great show. We'll do this again. And we'll give you a heads up so that everyone knows to tune in for the dental special. It seems to be more popular than anything we've ever done.
Yeah, this is great. And this will be on WPSL TV, which you guys can turn into a podcast if you want as well. This is WPSL, Port St. Lucie, Talk of the Treasure Coast, webcaster to the world on TuneIn.